The final part of this presentation identifies the key stakeholder groups who have a potential interest in the Stroke Rehab App and project, and who should be involved in the further development of the project scope. There are a number of key stakeholder groups with a potential interest in the Stroke Rehab project. The primary stakeholder group is, of course, the 35,000 odd stroke survivors who are discharged into their communities each year, as well as their carers and family members. Then there are a number of stakeholder groups that deal directly with stroke survivors, including the metropolitan and regional acute care hospitals that provide the initial life-saving treatments and assessments of stroke survivors. There are the metropolitan and regional subacute care hospitals that provide appropriate rehabilitation treatments for stroke survivors before they are discharged back into their communities. There are the stroke recovery and rehabilitation specialists and therapists who work in metropolitan and regional acute and subacute care hospitals. There are the community-based primary health care professionals, including GPs and allied health professionals, who service metropolitan, regional and rural communities. There are the for-profit and not-for-profit service providers who provide a wide range of non-medical services to stroke survivors living in metropolitan, regional and rural communities. There are community health centres that provide a range of medical services needed by stroke survivors living in metropolitan, regional and rural communities in some states. And there are the community-based stroke support groups who provide peer support for stroke survivors living in metropolitan, regional and rural communities. Finally, there are the stroke liaison officers who are employed by the National Stroke Foundation to carry out the National Stroke Support Strategy by providing a central referral service for every stroke survivor, and to provide follow-up and information about relevant community services, and to refer them to case management if required. There are also a number of stakeholder groups with a potential interest in the Stroke Rehab project, although they may not deal directly with stroke survivors. There are the medical professional bodies who are responsible for the registration and continuing education of the medical professionals who treat stroke survivors. There are the medical research institutions and research workers who develop new and improved treatments for stroke survivors. There are the stroke clinical networks, which provide expert advice to promote better planning for and delivery of high-quality, evidence-based, clinically effective stroke care services. There are the local government agencies which provide a wide range of services in the local communities in which stroke survivors and their carers live. There are the state government agencies which provide funding for a wide range of social services used by stroke survivors and their carers. There are the federal government agencies which provide funding for hospitals and provide some social services and pensions to stroke survivors and their carers. There are the national stroke associations which aim to reduce the impact of stroke on the Australian community as a whole and represent the interests of stroke survivors on a nationwide basis. And there are the state stroke associations which aim to represent their member stroke support groups and the interests of stroke survivors on a statewide basis. So, what strategic directions should the Stroke Rehab project take? Firstly, the project must benefit all of the key stakeholder groups identified in the previous slides. There is a need to consult all these stakeholder groups and to specifically identify ways in which they can benefit from this project. And there is a need to refine the project scope to take these benefits into account and to set project priorities. Secondly, all those key stakeholder groups must support the Stroke Rehab project and agree to cooperate in seeking funding and project implementation. There is a need to refine the project scope to reflect existing stroke, e-health and telemedicine projects. And there is a need to avoid wasteful duplication of effort. Thirdly, it is desirable to receive active support from Apple and the NBN Corp, because there is a need to make the best possible use of these new technologies. There may also be a need to keep overseas markets and other chronic disorders in mind. Finally, here are some questions I would like you to think about. Do you think this stroke rehabilitation project will be worthwhile? Are there any other issues that should be addressed at this stage? Is it feasible to form a consortium representing the interests of key stakeholders to scope the project in more detail, to apply for funding for the project, to manage the development of the project, and to manage the rollout of the project? To summarise this section so far, I have identified the key stakeholder groups who should be involved in and benefit from the Stroke Rehab App development, including stroke survivors and their carers, particularly those living in regional and rural communities throughout Australia, acute and subacute care hospitals serving metropolitan, regional and rural communities throughout Australia, medical organisations such as key medical professional associations, medical professionals including specialist stroke clinicians and therapists working in both the hospital and community settings, primary health care providers working in metropolitan, regional and rural communities throughout Australia. Research workers who are developing new and improved stroke rehabilitation therapies. Federal, state and local governments who fund various community services. National, state and community-based stroke organisations, including the Stroke Liaison Officers and Stroke Clinical Networks. Then, I briefly outlined my thoughts on the strategic direction that the Stroke Rehab App project should take and stressed the importance of getting support and cooperation from all key stakeholder groups and for getting their involvement in refining the project scope and identifying potential stakeholder benefits. Finally, I have asked for feedback on your initial thoughts about this project. Thank you very much for your attention, and I look forward to your feedback at this email address. Thank you.